greatest investment of our lives is health. So join me, Gladys Mumbua, every Saturday at 2:30 p.m. on Doctor's Call, where we get tips and knowledge on how to expand this vast investment. Good afternoon, viewers. Welcome to yet another episode of Doctor's Call. Thank you for joining us today. Hoping you had an amazing week. Today we want to talk about a topic called neonatal jaundice. Probably your baby has experienced it and probably you didn't have the right information or you didn't know what it was. Remember, you can follow this conversation on our social media platforms, Facebook and Instagram, Riverside TV KE. Today we have a guest with us. I'll allow her to introduce herself so that we can begin.
Thank you so much. I'm Jemima Njagi, clinical officer, pediatric, and I'm a pediatrician, yes, by profession. So I see children 0 years to 18 years.
Okay.
Yes.
So we've said the topic is neonatal jaundice. Let us now begin there. What is that?
So neonatal jaundice. First of all, maybe I'll start even by defining who a neonate is.
Okay.
A neonate is a child, a newborn who is 0 years. A child who has just been born up to 28 days. Okay. So then I'm right to say a neonate is a 1 month-old baby.
Yeah.
So what is jaundice? Jaundice is the yellow discoloration of the eyes. Normally we say the sclera. It is the white part of the eye. It is the one that is usually affected. So it can even go to the nail beds. These are the nail beds. It can also go to the rest of the body. So this is basically what jaundice is, that yellow discoloration, and normally it affects mostly these neonates. That is why it is called neonatal jaundice.
Okay. So what can we say causes jaundice? Now that you've defined it, what causes it?
Okay, jaundice is as a result of things we call bilirubin. These are things that are metabolized in the liver. So if they are not metabolized in a way that the body is able to handle them, so this is what is left and eventually gives us now this jaundice, this yellowness of the eyes.
Okay.
Yes.
Okay. So are there types of jaundice?
Yes, there are, and there are two types of jaundice. First, we call it direct jaundice. The other one is opposite, is indirect.
Yeah.
So the direct one we normally say is it is water soluble. When we say this, we mean it does not cross to the brain, to the central nervous system, which is the brain. So because it is water soluble, hence it has got no much issues. But the other one, which is indirect, it is lipid soluble rather than water soluble in the direct one. So when it is lipid soluble, meaning it can cross something we call BBB. This is the blood-brain barrier. When it crosses, it reaches the brain. So our main concern here with this topic, with this jaundice, is so that it doesn't reach the brain, because it gives us permanent damage.
Okay.
Yes.
So are there classifications that you can say these are the different classifications of jaundice?
Yeah, we normally classify jaundice into two major classifications. One is physiological, the other one is pathological. So when we come to physiological, this one, its characteristics, the characteristics now to say this is a physical jaundice, normally it appears within 24 hours to 72 hours of life. So it is around 3 days. So this is when it appears. So the maximum intensity goes up to 5 days, 4 to 5 days. When we are now treating jaundice, we normally we measure. We say it is the bilirubin that brings us these issues. Yeah. So we want to measure. Those are the bilirubin levels. So if the levels in the physiological jaundice, the levels do not exceed 15 milligrams. Okay. So clinically, it is undetectable after 14 days of life. So after the child is 2 weeks old, you're not able, it disappears itself. Hence, the physiological jaundice does not require treatment. You just observe and also assure the mother.
Okay.
So that is about the physiological. Now, when it comes to the other one, which is pathological, from the word, there's a pathology going on. So this is a bit difficult. So pathological, the characteristics that denote it is, one, it comes before 24 hours of age, so it comes earlier than the physiological
Yeah.
one. So it comes earlier, before 24 hours of age. Normally, when you measure the bilirubin levels, it's more than 15 milligram. Then it goes beyond 14 days of life, so itapita hata 14 days. So normally utajua this is pathological. This one, another point, it colors the clothes yellow. You find the child is passing urine, that the diaper everything is yellow, so you know there is an issue here. Also, this one requires treatment, unlike the physiological one that we just observe and then we reassure the mom. This one will require treatment, and it is in form of either exchange transfusion or.
Okay, so what essentially causes jaundice?
So when you want to know the causes of this jaundice, it is classified based on the time of onset. Like what time did it start? Like we remember when we were doing the classification, the physiological, you were saying 24 to 72 hours. The other one was appearing before even 24 hours. So we classify the causes based on the time of onset.
Okay.
So for the first one, we have causes of jaundice, that jaundice that appears within 24 hours of life. Causes, we have things like infections, can be viral, bacterial, all that, the infections. We have things we call rhesus incompatibility, ABO incompatibility. This normally is when mostly the mother is rhesus negative, the blood group. The baby is rhesus positive. So definitely there's going to be a reaction because it's not the same. We have negative here, we have positive here. So this is what we call rhesus incompatibility. So normally there's that, it is not compatible. What comes in is now the jaundice. We are able to know there's something happening. We want to know the blood group of the mother and that of the kid when we see this. So that is the cause of jaundice within that appears within 24 hours of life. So jaundice appearing 24 to 72 hours of life. We have number one, physiological, remember? The others, we have neonatal sepsis. Sepsis are infections. Any infection with this neonate, this will cause this jaundice. We have other things like hemorrhages or bleedings from within the child. So these again will give us this yellowness of the body. Then jaundice appearing after 74 hours. We have again the sepsis, neonatal sepsis. We have big infections like hepatitis.
How does jaundice clinically present itself?
So we normally do the assessment. This is how to assess a child with jaundice, for you to know this jaundice. So assessment utilizes the principle that the jaundice first becomes obvious in the eyes. So you first see the jaundice in the eyes, and then we have downward progression. Remember we said it is the yellowness of the white part, the sclera. It can go to the nail beds, it can go to the whole body. So it starts from the eyes, and as it progresses down to the body, the intensity increases. So meaning, if you have yellowness anywhere else, any part of the body, that one is more even serious than when it is just on the eyes. Yeah. So the downward progression increases with intensity. So the assessment of this child with jaundice, it should be done in a natural light. So we put the baby where we draw the curtains, where there is light for you to be able to see the yellowness. Then what we do it, we press the baby against over a bony part until that place blanches. Like what I mean is, this is what we call blanching of our bony part, so that when you do this, you will be able to see that yellowness coming back. This is what we mean. So that is how we do it, and you are able now to note the yellow color under the skin. So that is basically how we assess for the jaundice. Yes.
So you've seen this child, you've noticed that this child has jaundice. Now what approach do you take towards this baby after noticing that?
So approach to this jaundiced baby, so we have things we should, when we see a baby with yellowness in the eyes, we have questions that you should ask yourself. First things you should ask about the birth weight of this child. Why? Because birth weight affects. If a baby has got low birth weight, normally they are going to be affected even more than a child with a normal birth weight. So you should also ask about the gestation. The gestation is the number of weeks that the pregnancy lasted. So if the pregnancy was below 37 weeks gestation.
And 37 weeks is the recommended?
Yeah, 37 to 40. Again, it should need to be beyond 40. So 37, if this child comes before 37 weeks gestation, so you should ask yourself, because small babies will be affected by this.
Yeah.
Another approach when you see a baby who has jaundice is the postnatal aging hours. How old are we after the birth? Because we want to know, it is after 24 hours, is it after 72 hours? Ask yourself, is it physiological or is it pathological, depending on the characteristic. In deeply jaundiced newborn, you must be also be able to evaluate for presence of any central nervous toxicity, like has it reached the brain? Remember we said our worry is for this jaundice to reach the brain. It reaches the brain, we have a condition, we normally call it canicterus. I know it is a bit hard, so we don't want it to cross the brain and cause central nervous system toxicity. So you should ask yourself that. Maybe to tell you how to denote if this jaundice has really reached the brain, if we have CNS toxicity. So this child will present with weak muscle tone, like you holding the baby like this, they're floppy. They can't hold this hand, it just falls off. So this is how you are able to say this jaundice, mostly it might have reached the brain.
But wouldn't one typically just assume the newborn?
No, there's a way this child is floppy everywhere. You cannot, even the legs everywhere. Then you know already we have jaundice. So now you start having the floppiness. Now you start thinking of if it has reached the brain. Other things are poor feeding. This child will not breastfeed. Others are convulsions. You know those tremors. The child starts convulsing. So these are indications that this jaundice has reached the brain. So those are the approaches.
Well, viewers, we are going for a very short commercial break. Remember, if you have any questions, you can ask them through our social media platforms, Riverside TV KE, Facebook and Instagram, or you can send us a message on the number on your screen below. We'll be right back after the short break.
Are you looking for a place you can preach live on TV? We are now live. Yes, now we can cast your event live on Riverside TV just for 3,000 bob. Yes, 3,000 bob for 30 minutes. See flyers and posters for more info or call 0707 126 050. Riverside TV, inspiring and refreshing.
Welcome back, viewer. Remember, you can follow this conversation on our social media platforms. We are talking about neonatal jaundice. If you have any question, comment, any inquiry at all, you can make it through the number on your screen below. So, are there lab tests that can be conducted on this baby?
Yes, we have. We have lab tests. First of all, we say that it is the bilirubin levels that go so high for us to get this jaundice. So we really want to know the serum, the blood bilirubin levels, how much. We normally have the levels at which we say now this is too much. So the first test is that serum bilirubin level. We need to do that, and this is where we make the decision from this test. Other lab tests we do are blood group and the rhesus for both the mother and the child. We said we have rhesus incompatibility if the mother is rhesus negative and the baby is positive. So we might find this reaction is the one that is causing this yellowness of the eyes. We have things like a blood test we call full hemogram. That one we normally check the the WBCs in the body. These are the ascaris in the body.
Yeah.
So if you have any infections, normally they will target these the WBCs. So if they are so high or low, we see these are infections and they could be causing also this jaundice. We also have liver function test.
Okay.
So this is where, because it is where now the bilirubin is usually metabolized in the liver, so we need to know if the liver also is okay. So these are some of the tests that we do for this jaundice.
Okay, so we talked about the approach you can take to a jaundiced baby.
Yes.
Also, does the mother, knowing the history of the mother, does it help in knowing?
Yeah, we have some questions that we really want to know from the mother. If this child is jaundiced, we want to know if there is any family history of the jaundice, if there was another sibling that had the same, any history of liver disease, because again can cause this jaundice. We want to know if the mother had illnesses during pregnancy.
Yeah.
So we also want to know. We have things like how the delivery was, if we had traumatic deliveries also, we really want to know. So other things are, was this baby, we asked the mom, after the baby was born, was the baby resuscitated? This resuscitation is when the baby, we normally score a baby when the baby is born out of 10, a scale of 1 to 10. So we want to know if this baby is pink in color. So we normally score it with the color. Did this baby cry immediately? Because crying immediately is a sign of life. Or we were forced to do other things like looking to sanction. This baby had maybe some secretions. So this baby, you find that we call it birth asphyxia. Was it there? And normally it is the oxygen supply that does not reach the brain. So if there was resuscitation, we expect this baby to have jaundice later. So these are some of the questions that we ask the mom.
Okay.
Yeah.
Management. Is there any way you can manage jaundice?
Yeah, we manage jaundice. So to start with, we said that management is directed towards reducing the levels of bilirubin, and we also want to prevent central nervous system toxicity. So we don't want the jaundice to reach the brain, because we said when it reaches the brain, we have a permanent brain damage. Maybe you have heard of babies with CP, cerebral palsy. So this is one cause. And it is permanent, it is irreversible, so you can imagine. So that is why we really want, the management is geared towards preventing it from reaching now the brain. So we have some of the things we do to manage. We do early and frequent feeding. So we said, like, if it's a normal delivery, we want to start this baby on breast milk immediately. So, and we do it frequently, many times. Many times will help, so that because the breast milk will help further breakdown of this bilirubin, so that it doesn't appear on the skin or on the eyes. We also want adequate hydration. Still, hydration is through breastfeeding, because this baby, we said we want to give this baby just breast milk for the exclusive 6 months. So to prevent the dehydration, again, is through breastfeeding. Another way is by phototherapy now. We can use phototherapy with something we call exchange transfusion, or both. Either of them, either phototherapy or exchange transfusion, or both. Yeah, so that is how we go about managing this jaundice.
You've mentioned phototherapy. Could you please tell us more about the phototherapy technique?
Okay, phototherapy is a machine, if I may say, normally that we have. Normally, it has got, it's a crib or incubator. So we want to expose this baby to certain lights. We have either navy blue or white or green. So these are the colors that we normally have. So the baby is placed 45 centimeters from the lights.
Okay.
The baby is placed 45 centimeters. So what we do, the baby is naked. We expose the baby. It's only the diaper the baby is left with. So the only place we cover are the eyes. We use the eye patches. We close the eyes. Why? Because you don't want this light to damage the retina of the eyes.
Yeah.
So otherwise you want the rest of the body to be exposed to this light. This light is going to help break down this bilirubin even more.
Okay.
So now the baby is 45 centimeters away. Now after we place there, now we switch on the lights. So there we have things that happen. Normally we turn this baby every 2 hours or after feed. We want to turn because we want every part to be exposed.
Yeah.
Then as we are in here, we need to feed this baby. So we take breaks from the crib or the incubator to breastfeed the baby. So other things we do, we want to monitor temperatures every 2 to 4 hours. We want to do urine frequency. We want to monitor how many times the baby has passed urine while in that phototherapy. We want to do at least a serum bilirubin at least every 12 hours, so twice in a day. We want to weigh this baby every 12 hours again. We want to keep weighing. So then from there we stop the photo. If we stop the phototherapy, if the values, we repeat the serum bilirubin and the values are below 10, like 2 values are below 10. Now we know now we have improved.
Now you stop it.
Now you stop it.
Now, are there side effects of this phototherapy?
Yes, the side effect, the phototherapy has got its side effects. So what we do is we have got, the baby can get a skin rash, although this skin rash, it's not something that will make us stop the phototherapy. It's nothing, it's no big issue. So there's going to have a skin rash. We have temperature instability. So when we are there, we can have, when I say temperature instability, we can have either something we call hypothermia. Hypothermia when the temperatures are low, or hyper when they are high. So we can have either fevers or we can have low temperatures. So we keep, that's why remember we said when the child is in the crib, we keep measuring the temperatures every 2 to 4 hours.
Yeah.
So another side effect, we have diarrhea. These children get loose stool.
Yeah.
So that is why we want to feed every time we are in the incubator. So this is another side effect of phototherapy. The major one that is we should worry about is something we call bronze baby syndrome. That one normally it is when now we see there is brown discoloration. Some parts of the body we have started getting some brown discoloration. This one we say it is because of direct bilirubin. So that one we should stop the photo. We look for an alternative.
And is it permanent or it will go away?
It will go away when we notice early and stop and maybe start working on it.
Okay.
Yes.
Okay, so are there measures a mother can take to probably prevent neonatal jaundice?
Yeah, we have some parts that mothers play, like the antenatal clinics. You see, we advise moms to go for those clinics several times when they are pregnant. Why here it's when we do something we call antenatal profile. Antenatal profile, we want to measure the urine. So if we have an UTI, we'll pick it early and treat it.
Yeah.
Here it's when we know the blood group of this mother, the rhesus factor, are we rhesus negative? Why? When you find the mother is rhesus negative, now we've come to giving birth. Is what we prevent. We do this an injection called the anti-D. What we try to do, we want to introduce antibodies because the group negative doesn't have those antibodies. So the anti-D will give. So we normally give this injection to moms before after they give birth, before 72 hours are over.
Okay.
So we give this anti-D. So we give precautions before. So antenatal is everything. Go as many times as possible. You'll be able to pick many things.
Okay, Doctor, you can look at a camera and tell parents anything about neonatal jaundice.
Okay. Neonatal jaundice is a common thing, and for sure it's something we can be able to prevent. So just attend those clinics. They are important. It is when we start picking things and we avoid this jaundice even later. So now you have the knowledge that we have something we call physiological jaundice, which is normal to most kids. So don't come to hospitals running if it is just it's not so much, and it's only on the eyes. Again, if you see that it has gone to the skin, don't stay at home, so that we can be able to manage this. Bring the baby to us, to the hospital, so that we can be able to manage.
Okay, thank you. So how can one get you? Probably your YouTube page, so for more information, because we may not cover everything here, but you probably cover it there.
Yes, I have a YouTube channel by the name Jamie Naftali. That is where we talk of, it's called the pediatric world. It's a world of children. So we want mothers to create the awareness to mothers on what really happens to these kids when growing up. We want to involve them into management of these babies. So visit the YouTube channel by the name Jamie Naftali. I always have a video for you every Wednesday. In Facebook, it's Jamie Naftali also in Instagram. So welcome.
Well, our viewers, you have had all the information. In case you need to get in touch with Daktari, she has given you her YouTube page. You can go over there. You can ask her questions or anything. Until next time, I have been your host, Gladys Boit.